Some of this technology is very effective, but it's few things that are effective, whereas there's just a mountain of poorly indicated, poorly executed stem cell injections for which everyone's a candidate with a credit card. But it's not enough to just take them from the freezer and put them into the knee. Most patients who come to see me who spend lots and lots of money on stem cells will honestly admit that it was a waste.
One you're passionate about when we were talking on the phone was stem cell therapy and incorporating it within spine surgery, and it can provide better options.
Ram, I'm up to date on stem cells, and I'm going to disappoint you. If I take a bunch of little kids from kindergarten and I have them hang out with you in clinic, are they going to become great podiatrists like you?
Probably not.
It's the same thing with stem cells. You take immature cellular lines, whether you get them from the amniotic cord, which then goes to the freezer, or from the fat, from the blood. If you even believe that some of these cells survive the journey, what makes you think that injecting them into the knee is going to have these cells develop in line with cartilage or with ligament, whatever is the defective part that's causing pain? There's no evidence to say that stem cells will become what they are surrounded with. There's no evidence like that. The current state of science is to figure out how to train stem cells. How do you make stem cells develop in one or another direction? Some of this technology is very effective, but it's few things that are effective, whereas there's just a mountain of poorly indicated, poorly executed stem cell injections for which everyone's a candidate with a credit card, which is the big bugaboo of any medical innovation, is that once it becomes popular, it sort of enters the magic realm. And it's very unfortunate. Stem cells are an option, but it's not enough to just take them from the freezer and put them into the knee. Most patients who come to see me who spend lots and lots of money on stem cells will honestly admit that it was a waste.
I can see that.
Jupiter, Florida, that had its partnership with Stanford, while Brown University was doing the same research and corroborated the results completely, which is just eerie. Stanford had the intellectual property. Brown was doing this without that information. Same results. We get the platelet-rich plasma, and then we suck out through another machine one protein out of that whole fluid. See, PRP's got all the elements: build, destroy, bring blood vessels, take away blood vessels, pro-inflammatory, anti-inflammatory. But one protein called alpha-2 macroglobulin, or A2M in short, was developed by a very close friend of mine. That protein will slow down your own cartilage debris pickup crew. So there are these sort of stem cell-like crews called metalloproteinases that drive around your knee and your hip, and they clean up cartilage that's been denuded or been injured. They can become overreactive. And if you slow them down, you see an incredible improvement in patients' extremity pain and joint pain. Just one example, but it's not enough to just take some freeze stem cells and push them into the joint. It's wishful thinking.
And I can see, I remember coming across it back in 2009, and I kind of stepped away from the kind of development from stem cell therapy. In the beginning, it was a big hype. I had a friend who was a physician back in the UK who set up a company. I think he just let it go, but it was just something that I thought I could talk to more about with you, because you had an interest in it. I thought maybe there was some sort of like new innovation coming in now in 2022, but I suppose hasn't really taken course yet because it has limitations, as I can see. And
it's coming, but it's going to come with different sort of name. It won't be just bring some stem cells from the freezer. It will be how do we get your own cells to behave in a way that is controlled, expected, and reliable. That's the future of stem cells.